Hi, and welcome to this installment of Frank and Mary here on Nantucket. If you haven't seen this show before, my name is Art Bergeron. My day job, I'm an elder law attorney. I work at Myrick O'Connell back on the mainland, and I'm here like every other week. This, of course, is not about elder law. This is about my friends Frank and Mary. If you've been to my presentations at the Salt Marsh, you know Frank and Mary, their goal in life is to live in their house until they die and be buried in the backyard. And if they're on Nantucket, they never, ever want to leave, except that over the last few months, they've been trying to get out of that house more. But now that things are loosening up, they're doing so. So as you know, I have this wonderful co-host, Allison Forsgren, who has been here forever and who has been in charge forever of finding us these great guests. Allison has terrific people for you here today to talk about some of the issues that are kind of directly related to COVID-19 and how you can keep safe and what the resources are if you're thinking that you're not well. Allison, whom do we have today?
Well, we have two guests today, both from the Nantucket Cottage Hospital. First, there's Dr. Diane Pearl, who's the Chief Medical Officer for the hospital. And along with her, we have their communications specialist, Jason Graziadei. Jason, please fix that.
Jason Graziadei.
Graziadei.
That was
Thank
very
you.
close. That's good.
So yeah, well, thanks for coming on the show today. All eyes are on the hospital and where Nantucket is right now regarding COVID-19 infections, and we'd like to hear a little bit about how you see things going here and how in the world we were able to maintain a 14-person infection rate this far into the season.
Which has to be pretty exciting for both of them that they managed to do this. You know, there are a lot of people, you know, that can be taking, I don't want to say a victory lap, you know, but at least kind of patting themselves on the back that we've made it through this, and especially on Nantucket, you know, with a lot of success. So as Allison had mentioned to the both of you, Dr. Pearl and Jason, one of my jobs as a person who visits and is not always here is to ask you how you ended up here or were you really from here? Every once in a while we find a person who was really from here. So I'll start with you, Jason, and then I'll ask Dr. Pearl. Jason, how long have you been here and how did you get here? Or have you been here forever?
No, I'm a wash ashore. I moved to the island in 2004. So I actually came out to Nantucket then to take a job working at the newspaper, the Inquirer Mirror. So I had never been to Nantucket before coming out to interview for the job, and then ended up moving here and you know, thought I'd stay a summer and then maybe another summer, and then that turned into another one, and ended up you know, meeting my future wife working at the paper, who is from Nantucket and grew up on the island. And so now I have lots of in-laws and family all across the island, and started working at the hospital in 2013 after about 9 years at the paper, and have been in my role as the communications officer since then.
That's a great story. So you've really become homegrown, you know, over your time, you know, and you get, you know, and now you know everybody, right? So
yeah, well, my father-in-law reminds me that I'll never be a native. So he reminds me of that.
You never get that pass, right? So how about you, Dr. Pearl? How did you find your way out here?
Well, Jason knows a lot of natives, and he's related to a lot of natives, including me, as a matter of fact. Because Jason happens to be married to a distant, well, not too distant, second cousin once removed. Anyway, my parents both grew up here. They moved here as children, and I was born here 60 plus years ago, along with my 7 brothers and sisters. And my mother had 10 siblings, and so they all grew up here, and my father had several siblings. So we're part of a small clan, which includes Jason.
That's great. That's great.
So,
yeah.
Both of my parents went to Nantucket High School, and all of my siblings and I, of course.
Wow.
That's a great story. So thank you very much, both of you. You know, and it is an amazing thing that we find ourselves talking to a lot of relatives when we're on this show, right? The nature of Nantucket.
Mm-hmm.
So Allison, what were you going to ask?
Well, I would first like to hear what you both have to say about how we got to where we are, relative to the infection rate, and what are some things that we should be looking at doing as the season is approaching, because just today the traffic and the people and the it's coming a little bit later than normal, but how to prepare for this.
Well, thanks, Allison. I'd like to take that one on myself to start with. I often think back to early March when things were kind of still normal, but we were hearing about this disease coming our way. And very intelligently, I guess, the Massachusetts government, started to shut things down quickly in early March. Now, some would say not quickly enough, because Massachusetts and Boston have had really kind of enormous rates of disease, but things shut down relatively quickly. And Nantucket was in a great spot at that time. We have a very low population in early March. We had no visitors. It was a quiet time as far as travel, and things shut down quickly. We had most of our cases in the first few weeks, I'd say, in late March and early April. And since then, we've had very few additional cases. People did come to Nantucket bringing the virus with them from wherever they traveled to get home, because they had to get home because the world shut down, as you know. But since we've all been living together in Nantucket throughout April and May, we haven't been spreading it in our community. There just has not been community spread. And that's because people are staying home. At first, the first lockdown weeks were very well carefully adhered to. And then we've all been wearing masks, we've all been washing, we've all been very careful with distancing from each other. And I think because of that, the community efforts at being compliant with the recommendations, this has not become a community spread disease. So we are following.
It's incredible.
It is incredible.
Amazing.
Incredible. Now, a lot of my patients are older, and they have not left their homes sometimes for these last 3 months. They're having groceries delivered. They are not going to the Stop and Shop. They're not socializing. And many of them are quite happy, content, and willing to go forward with that until this is over. So we have had a great response in our community to this epidemic. Just to remind everybody, at the peak, there were 3,000 new cases a day in Massachusetts, and this week there are more like 100 a day new cases of COVID-19 in Massachusetts as a whole state. So this is very, very quiet at the moment. And
how safe should people feel with those kind of numbers, not only locally, but in the state of Massachusetts? People are coming in from out of state every day, and some of the things I've read have said that with little community spread, you might consider easing up on yourself a little bit when it comes to self-isolation or stay-at-home orders. I mean, what is your best advice to people who are craving some like a meal out or a visit from their grandchildren? I mean, how can you possibly do that safely, or can't you?
I am not comfortable with thinking that we are safe, because we will have a recurrence. So that does not seem reasonable to me or smart. So for most people, we just should continue following the same safety measures of wearing a mask. That probably is the most important thing. And then keeping distant from others is another very important thing. The washing, of course, washing hands, really important. But yes, it's great to be able to go outside again, and it coincides with nice weather. And being outside seems to be one of the safest things one can do. Socializing outside seems to be very safe. So if we want to have a picnic together, or even a glass of wine with your neighbor on a porch, we can stay distant. We can hear each other from a distance. We can even potentially take a mask off and stay 6 feet away to talk. or to have a glass. You have to take your mask off to eat and drink after all. But I think that certain things are safer than others, obviously. And I would want my older people or more fragile people to really still be cautious about crowds and gatherings inside the house with people who have traveled. Children are a problem. Children have, so here's how we think about, I have 3 grandchildren here on the island, and I would like to see them more than I do. We socialize outside. We have a picnic where we can stay distant from each other. And some of the reasons are because they see other people and they have maybe contacts that I don't want to, and I don't think I have the virus, but I don't want to spread the virus to anybody if I did. So we need to be careful about our own responsibility in keeping other people safe. And then if you're fragile, watching out for your own safety.
Wow. Wow. No, that's, you know, the whole mask wearing thing is, I'm sure, you know, I've heard is really, really important. But still you go downtown and you see people who don't even have a mask in their hand. So is the best thing to do if you are, you know, to avoid them or to walk around them, or how do you maneuver around people who aren't, you know, cooperating with the suggestion of mask wearing?
Yeah. Well, try to avoid if you can, and obviously move quickly past, but don't engage in conversation, close conversation. Now, the studies do show that it's relatively difficult in passing by somebody to get the infection. The virus dissipates in open air. The virus does not spread that far. They would have to be very heavily infected with a lot of viral particles and all that kind of thing. But the chances are there. There is still the chance. And so these are very, for everyone to be masked and distant is extremely safe. And then we have levels of safety. One person wearing a mask, nobody being infected. Those are relatively safe. And being outside is much safer. But because there's no 100%, we are really recommending the most careful approach to everything. And as you said, Allison, many people downtown don't feel the fear of this disease, obviously, because they aren't wearing masks or they're in groups of people not wearing masks. But, you know, to take care of yourself is the most important thing, and you're going to avoid those situations.
And by wearing a mask, you're sort of sharing that you care about not infecting other people, correct? As well as keeping yourself safe? I
think it's a sign of respect for others, that you're doing it because you don't want to run the risk of infecting other people. It also does protect you to some degree.
That's just what I tell my clients, you know, especially these young people. I have a good friend who runs a home care agency in Central Mass, and she had these wonderful T-shirts talking about respect and masks and things. And the main thing in the center says, because someone I love is a senior, you know, it's just in these times where it has become apparent that the level of risk is really much higher for seniors than it is for others. You know, it's just taking care of some, you know, fine, you know, it's fine for yourself, but you just need to take care of everybody's mother and grandfather and all of these other people, you know. And I have to say, by the way, going back to Allison's point about the ubiquitousness of masks, I regularly, I come to Nantucket every other week, and my off weeks I go to the other island, you know, which some refer to, they say Bermuda, no, the other island. But I've been amazed at the much higher percentage of mask wearing even here compared to there. You know, that there just seems to have been a tremendous sense of community here, of people really showing respect for everybody by buying in, you know, and wearing a mask, which has been terrific. Terrific.
I mean, it was terrifying at the very beginning, thinking that there are no ICU beds here, and few ventilators. And if Boston got full, where would you go? So, you know, once things started easing off in Boston, it wasn't such a frantic feeling of helplessness, but I've never felt like that before, or felt like being on Nantucket was a bad idea. But I'm glad that has passed, because I have every confidence that if people can't be handled here for care, that they'll be able to be med flighted. I mean, is that what would happen?
Well, that did occupy the majority of our time back in March, because we realized that if they couldn't take our patients in Boston, they were inundated and absolutely full, we would be on our own. So much of our planning revolved around how can we ramp up the number of ventilators, for example. So we might have had 8 in actual readiness, but we had maybe 20 in the background ready to come on line. And how would we best expand our rooms? How many rooms could we possibly get? How many patients could we possibly house if we had to? So these planning meetings went on day after day, every single day, for a month. And could we use the school? Could we use the Boys and Girls Club? We had a contingency plans if we going out for a long way. So we were planning for that exact scenario, and thankfully it did not come to pass.
Yeah, because you just
So
couldn't.
I'm sorry, Allison. Could I ask the two of them, or the two of you, at this point going forward, now that we've kind of, wonderfully, we're past that, at least that what could have been catastrophic. Going forward, to both of you, kind of how is the hospital thinking about this? Because we all know the mindset that until there's a vaccine, you got to be careful. So how is the hospital kind of thinking about this and kind of ongoing preparedness? And also, so if I'm a Nantucket resident now, and I had deferred coming to the hospital, for something that was not an emergency, and now I'm thinking about, are there any issues that I need to have now with coming back to the hospital to get all of this stuff done?
Well, first of all, we're prepared every day, 24/7, for a COVID-19 patient, or several of them. So we have rooms which are made just for that purpose, designed to keep the patient safe and the staff safe. We have protective equipment available that we can keep people here for a few days if we want to, or until they recover, and have enough equipment and enough the safe rooms that have the right ventilation. And so we know that we can take care of COVID-19 patients. So we prepared for that. We're ready for that. Obviously, if they're very ill, we need to transfer those patients to a higher level of care in a tertiary hospital. And then we have prepared also to keep the hospital as much COVID-free as possible, so that we have areas that should not and have not been exposed that we know of, because we screen people before they come into the hospital, and anyone with any symptoms doesn't come in to the regular hospital, but only to these safe areas. That everyone is wearing a mask, all the staff, all the visitors. There have been extra cleaning strategies brought online, and we're very confident that the hospital is a very safe place to be. So you can come in, you can have blood work, your x-rays, your doctor's visits. We don't see anybody in the clinics who have any symptoms which would suggest COVID-19. So we have that all set up in a separate area. We would like to continue to serve people for their regular needs now that we're ramping up again.
And I would add to what Dr. Pearl said, is in addition to the preparations that she described in terms of being able to take care of patients, what we've also done as a hospital, working in collaboration with the town, is we've really ramped up our capacity to do testing, not just of symptomatic patients, but asymptomatic patients, people who are not experiencing any symptoms, to really have some robust surveillance testing capability, so we can actively test, identify new cases if we find any, do the contact tracing, and isolate those individuals to really try to prevent any community transmission or any spread. So we're in a much better place than we were when we started, to be able to do surveillance and identify new cases. Gratefully, we haven't found any as we've ramped up the testing. But I think now, as our population increases and we move into summer, that capability that we have is really important, to be able to quickly identify any potential new cases. We have trained more than, I think, 26 people at the hospital and volunteers in contact tracing to be able to do that and call them into service if we need them. Thankfully we haven't. So I think that's another key piece that we've done as a hospital to prepare for the increased population in the summer and any potential sort of second wave. We never really had a wave, but if we begin to see some more cases happening in the summer.
And Jason, if I could ask just to follow up on that, it's great that you've got that testing capacity there. If I'm coming in to get tested and I'm asymptomatic, so I don't have a, or I don't have a doctor's note or anything, is that insured, or is that a cost to me to get tested?
Sure. So it's a little bit of a complicated answer, so bear with me. But what we've done is
an important question. That's why I asked, because that comes up. People have talked about it, right?
So I mean, first I would say, and Dr. Pearl can correct me if I stray here, but if you have any symptoms, one or more symptoms of COVID, you can come to the drive-through and get tested, and that testing is fully covered regardless of your insurance coverage. So if you have a, sore throat, muscle aches, you lose your sense of smell, any of the other symptoms that we've heard about that are, indicated for this disease, we're telling people to come, you don't need an appointment. Now, the asymptomatic testing is different, and what we've done in collaboration with the town is there's a grant program, so the town has allocated money to test asymptomatic patients, asymptomatic patients who are considered high priority for public health. So these are people who are in high traffic industries, transportation workforce, grocery, and those would be funded. And what we've done is set up a website with the town where folks, either employers or individuals, can apply to have an appointment for elective asymptomatic COVID testing. So if they're in a high priority for public health, they would be covered. If not, there's a self-pay option for folks who would like to be tested, feel the need to be tested, but don't have any symptoms. And that is at a self-pay $150 per test. So we've made that available to the community, and some of them employers are starting to take advantage of that to test their entire staff. It is a little, we have the funding to do people who are considered high priority that have the greatest risk of exposure or transmission. And then other folks also have the option of, their family is coming to the island or they're arriving on the island, they would like to be tested. We do have that capability where they can register, apply to get an appointment at our drive-through and come through for testing as a self-pay.
That's great.
Yeah, and
that's great.
And so you have, your granddaughter's coming from Connecticut, and she's going to stay with you for the summer. You have the capacity to have her be tested for $150, and then that is not carrying it. That doesn't mean she won't pick it up, but the chances are low that with no community spread, that will happen if you're safe. So that seems like is that a decent scenario for someone who would love a visit from a relative and a house guest?
Well, it is good, but it's not perfect, and we can't rely on that because she could have picked it up traveling here. She could have picked it up several days before she gets here, or before she develops enough virus that would show a positive test. So let's say she was just infected and then several days later, and even never gets symptomatic because many young people don't have any symptoms. So that in combination with a 14-day quarantine and never seeing anybody, I guess that gives you some reassurance. But for these employers who are bringing on a large staff of people from all over the place, I think the starting point of having negative staff members is very helpful and reassuring, and is not a bad idea. I was just reading in the Globe this morning that some of the tech companies in Boston are having their employees tested once a week, and employees that are coming into the lab, for example, because if you don't test on a repeated basis, you just can't get that security. To your point, Allison, if they go out.
The amount of testing being done in Massachusetts now is just huge. I was on a call this morning because I live in Marlborough, and I'm on the Economic Development Corporation board, and another member is the person who Quest Diagnostics is here, and they're now doing 40,000 tests, they said, a day in Massachusetts.
Mm-hmm.
So that the amount of it once again, what's the blessing of being in Massachusetts? They really ramped up a lot of testing. You know, it's wonderful.
Yeah, and I would, echo what Dr. Pearl just said, and because we've had people who have reached out to us about this and said, so I can have my family member come and get the test, and then they don't have to quarantine, correct? And that's not what we're saying, and that's not what we're advising. Really, those precautions should be adhered to, if at all possible. The testing is helpful, but it is what Dr. Pearl said. When they travel, and then come here and get tested, they may not develop symptoms or be able to indicate that they're carrying the disease, depending on when they're tested. So we don't want people thinking that this is a way to get out of the quarantine recommendation that is in place for a good reason.
Wow.
I think the more important thing is if you were positive, you were an asymptomatic, healthy young person, you were screened as a part of this going to work, and you found that you were positive, that would have enormous health benefits for the community, because then you would not expose all your coworkers, and you would be isolated until your disease was passed, and you would thereby save us from this spread throughout the community.
Well, so what about antibody testing? I know that we're testing for the virus itself, but is that something that will be coming soon, or is that something that is an important part of the process going forward until a vaccine?
Yeah, we're trying to understand the role of antibody testing. We have the capability, or we're on the cusp of having it here at the hospital. We have access to labs that do run those tests, and we have sent a few people for those tests. Interestingly, everyone who thinks that they're positive so far, I have maybe 5 people who could swear that they had the disease in February or March, have been all negative. So perhaps they had influenza or something else. But there is going to be a role for antibody testing. We're not sure what it is at the moment. And so people are curious, and they want to know if they've had it or not. That's one, but that's not a very strong indication, and I don't know that it's covered by insurance because of that. Community-wide, though, it would be wonderful to know how much we've had in our community. That's the interesting part of widespread serology testing or antibody testing. Has it been here unbeknownst to us? Do we have 10% positive rate? We don't know. And that kind of a study is what we're thinking about. We're trying to get on the ground running.
Yeah, that's really interesting to me. I mean, has it been here all along and we didn't know it, or does the water have something in it that's keeping us safe? I mean,
the water. Oh, that would be bad.
The water.
Yeah. So Allison, this has been just terrific. My job is to ask people if they're from here, and also to keep track of the time. And I'm looking at the time and realizing that we're about out of it. This has just been terrific.
Thank you so much, because there's so many questions that people have, and to have answers to part of them even is really helpful. So we have a pretty big audience on this show, and it'll go out to a lot of Saltmarsh Senior Center people. Wouldn't believe the people that watch the show. So hopefully they'll take all of this information home with them and share.
Well, thank you very much for having us. I really appreciated being asked and being here. So
anytime.
Yeah, reach out anytime.
Great.
Thank you, guys.
Dr. Pearl. Thank you, Jason.
All right. Thank you, everybody. Bye, Arthur.
We really appreciate it. Bye, Allison. And folks, we'll see you on the next installment of Frank and Mary here on Nantucket. Thank you very much for watching. I hope you found this helpful.